We are a student research group from Kelly Parsley's 333 class. We are here looking at mental health and isolation experience here at Carroll. My name is Eliza. I'm the project manager, and everyone else in this group will introduce themselves as they come up to do their part. So in today's presentation, we'll talk about our methodology, our readiness assessment, all of the interviews that we conducted, our outlet density scan, all of our environmental scans, as well as our educational awareness posters, and everyone will talk about this more in depth later on in the presentation. This is a quote from our annotated bibliography that we did at the beginning of this project. It says, the prevalence of symptoms of anxiety disorders is approximately 3 times higher than those reported in 2019. So this really stood out to us, and it shows how the pandemic has affected all of us, especially students, and we really just wanted to see how this quote applied to Carroll's campus specifically.
Our interviews consisted of students who are quarantined on campus, students who are quarantined off of campus, athletic coaches, health and medical professionals, and Carroll College staff. These are the first 6 questions that we asked our interviewees, and then these are the next 5. So we want to look at question 3. Question 3 stated, on a scale of 1 to 10, how big of a problem do you think mental health is at Carroll College right now? And 60.3% gave it a ranking of 7 out of 10, meaning that over half of the people we interviewed think that mental health at Carroll College right now is a problem.
I'm Maddy, and we looked at question 4 that asks, on a scale of 1 to 10, how good of a job do you think Carroll is doing in ensuring isolated students get what they need? And these answers were all over the board. There wasn't one consistent rating. Among those who gave it a lower rating, they described inconsistency when it came to receiving food, and check-ins from staff at Carroll were rare. And those who gave it a higher rating described students getting the essentials that they needed while in quarantine or isolation, but communication and information was lacking. And question 6 had more of a consensus. We asked, do you think that there is a difference in the mental health of students who are isolated on campus versus those who are isolated off campus, and why? And 75% of the people we interviewed said yes, giving reasons like being able to walk outside and quarantining with other people that you know. The comfort level of those quarantining at home was also a big factor. And question 7 asks, have you felt any new or worsening mental health problems since COVID started? And if yes, explain why. With the majority answering yes, some reasons that they stated include stress from school and isolation on top of it. It was easy to get behind in classes. And online school was more difficult to learn and understand, with videos being blurry and voices cutting out. It was hard to follow along. And there's more anxiety and depression as the Carroll community was not as strong as it used to be.
Groups. We completed interviews within 2 focus groups, and they were students that quarantined on campus versus students that quarantined off campus. And students that quarantined on campus were put into designated dorm rooms and residence halls and the on-campus apartments. Students that isolated on campus expressed in their interviews that they did not have the opportunity to go outside for a full 2 weeks, which was hard on their mental health. Someone quoted that 2 weeks is too long to be isolated in a dorm room. Students that live in the on-campus apartments typically don't have meal plans, so when they had to isolate in their apartments, they had to ask what they should do about their meals. The response was to either Uber Eats or DoorDash their food. This was an issue because some people don't have friends that they're close with that they can go out and go buy groceries and other essentials for that person or their roommates for a full 2 weeks. Students said that while they were quarantined in either a dorm room or in the apartments, that they got the bare minimum of supplies. For example, one student said that in the apartment she was moved into that there was no silverware on plates, and the apartment said that, or the apartments, when they were in the apartments, the staff delivered food, but they didn't get any utensils.
My name is Tony. I conducted a focus group of students that were quarantined off campus, and a lot of the findings were contrary to those compared to the students that were quarantined on campus. Some of the questions that were answered were about forced social distancing, that being made to quarantine in a house off campus led to loneliness because they weren't allowed to interact with friends, uncertainty of what they could and couldn't do. Could they go to the grocery store, or could they go out for walks and that type of thing, which also led to anxiety because were they possibly breaking the rules unknowingly, and potentially were they unknowingly spreading the virus that they had. One person answered, there was a question with regards to, did fear of COVID stop you from seeking medical treatment? While his answer was no to the fear part, COVID did stop him from getting a procedure 2 hours prior to surgery time. So COVID did in fact stop him from receiving medical treatment. Off-campus quarantine, there was consensus that it was better than quarantining on campus, mainly due to the fact of more freedoms, that you could sit outside and enjoy some fresh air and some sunshine, and you can interact with those who you're quarantined together with and still had some interaction. You could also go on walks. I also interviewed some medical professionals and mental health professionals in the community that had a few comments as well. One comment was made that the national reduction in hospital visits was early on. It was about 25% reduction in emergency room visits nationwide from those that were fearful of contracting the virus by going outside. That now isn't a thing, mainly because, as the mental health professional commented, that people are seeking treatment simply because they are tired of being locked up and locked away from others, and this has gone on for a year, and so they kind of are okay with taking the risk. We've also seen, another provider said that we've seen an increase in suicidal ideations and increase in anxiety, specifically among school-age students and age groups. And lastly, why was there fear in the community? And one of the providers mentioned that possibly because of mixed messages coming from the government and private practice, and who do you believe in, and which treatments to follow.
My name is Josie, and I'm going to be talking about environmental scans of classroom buildings on campus. So environmental scans are a way of screening for data around the area that you're conducting your research in. And so as a group, multiple environmental scans were performed. And we looked through campus buildings, and we looked for posters that advertised mental health resources that could be utilized by students on campus. First, we looked at O'Connell Hall, and we found one mental health poster that advertised the relaxation room in the wellness center, and two in Charlie's, mostly about hand washing and wearing appropriate masks.
Hi, my name is Nainoa, and I also took part in the environmental scans that we did. So in our environmental scans, our group found that there was a huge lack of advertisements about available mental health resources on Carroll's campus. There aren't many postings of flyers or resources specific to COVID or the effects that it can have on the mental health of students. Students who have to quarantine have the bare minimum of resources available to make quarantine easier for them. There are no furniture in the living spaces, there's not many chairs or utensils provided, and in areas used for quarantine there is inconsistent amenities to make isolation less negatively impactful on individuals. So for our scans on the quarantine areas, we did apartments, the on-campus apartments, and the Guadalupe Hall, which is the freshman dormitory. The apartments and Guad have basic amenities, but as you can see on the slide, there's nothing to help with someone going through quarantine. There are no resources or guidance readily available to help someone in isolation, and there are no materials for people to use if they need to contact someone for like an on-campus emergency or just counseling. Quarantine spaces should be better equipped with things for eating and entertainment to get through quarantine with little to no effect on your mental health. And we think like things like a TV, a microwave, or a mini fridge, or just snacks available, and resources on possible effects that isolation may have on students could go a long way. And bottom line, we just think students should feel cared for and not alone during this process.
Next, we did an outlet density scan. So what I looked for was counselors within a 1 mile radius and a 2 mile radius of Carroll College. This is not including the wellness center, so we just want to see what else was out there in the community regarding resources. So I found within the 1 mile radius that there are 7 counselors, and then within the 2 mile radius there are 9 counselors. And of those, 6 of them clearly stated on their websites that they do virtual sessions. And both the 7 and the 9 did state that they do sessions related to feeling isolated or depressed.
Measuring readiness is a systemic analysis of an organization or university's ability to undertake a transition. And so a readiness assessment is conducted to identify challenges that may arise when implementing new processes or new procedures. And so from our assessment, we concluded that Carroll was at the vague awareness stage. And we thought this because while Carroll has made some great strides in helping students through their quarantine experience, there's some ways that it could be better handled and ways to better help students through their quarantine time.
So here we have our social norms and educational flyers. Our social norms flyer on the left is meant to persuade individuals to follow the crowd and do what everyone else is doing, but in a positive way. And we chose to advertise adults who wear masks on college campuses. And for our educational flyer, we chose to promote ways to support people who are in quarantine. And these ways are easy for people to support their friends to hopefully provide some consistency to those in quarantine or isolation. And we placed 40 of each of these flyers in different areas of campus, in different bathrooms, and in the cube and dorm buildings.
So we had a few things that surprised us and what didn't surprise us with this project. So one of the things that surprised us right when we started out is that there's no posting in any quarantine spaces of COVID-specific resources for students who are isolated. Another thing that we discussed was the interviews regarding Carroll's response to isolating students was not consistent. As you saw in one of the questions that we already highlighted, the answers were all across the board, meaning that students individually got different treatment depending on when or where they were in quarantine. Another thing that surprised us was the lack of mental health awareness in COVID isolation spaces. This kind of ties into the first point. So there's no resources posted that says who you can talk to or where you can go if you have any questions. There was also a lack of communication from administration and a disconnect between administration/volunteers and students. So some students wouldn't get their meals and wouldn't know who to contact. So what didn't surprise us is that here at Carroll, over half of the people we interviewed said that they experienced new or worsening mental health conditions. So this ties into the quote that I introduced at the very beginning of this presentation, which demonstrates that Carroll does fit into that national average of seeing increased stress and anxiety rates in college students. There's also different isolation experiences from those who are quarantining on and off campus. We discussed that earlier in terms of just overall experience. Some people got to quarantine with their friends if they were off campus, and they didn't have to rely on Carroll for meals and such. Another thing that didn't surprise us was that over half of the people we interviewed rated Carroll's problem of mental health at a 7/10. This also ties into the quote and shows that college students, even at Carroll, are really struggling right now. And there was also just a lack of resources to accommodate everyone in isolation. So people didn't have equal amenities, some people didn't have dishes, some people didn't have chairs, and students right now really need that level of consistency. These are our recommendations going forward to Carroll. One of the recommendations that we discussed in one of Kelly's classes was to put money into an app like Headspace or something similar. Some universities have done this. Headspace is a mindfulness app, and it allows students to log in, and you can pick your meditation or what you want to focus on for the day, and it has emergency videos for anxiety or panic attacks or depression. So that would be helpful to students who are struggling in quarantine. Another thing would be to ensure that isolated students have someone to contact if they're struggling, whether that be a counselor down at the Wellness Center or a volunteer who's just supposed to check in with students when they go into quarantine and throughout that time. There needs to be greater coordination between volunteers to really ensure that students are getting what they need. This means coordination between volunteers to drop off meals or to just drop off anything that students need in terms of living in that space for the next 2 weeks. Another thing that we talked about would be meal donation for students who live in the apartments. It is not widely known that students at Carroll can donate their swipes or their meals. So it would be smart for Carroll to advertise that there is this donation program and to make it specifically for students who live in the apartments, as they often don't have meal plans. And then they can get meals delivered to them in quarantine. And the last thing that we recommend would just be consistency between isolation spaces. As we talked about earlier, students got inconsistent amenities, and that really needs to be evened out so each student going into isolation has the same resources and the same accesses. That is our presentation. Thank you for listening. My email is on that slide, so please contact us if you have any questions.